For joining us on TVC Media News. Let's begin with a humanitarian gesture by the presidency. President Bola Tinubu has approved a landmark subsidy to ease the cost of kidney dialysis for Nigerians. With this intervention, the price of each dialysis session has been reduced from 50,000 naira to 12,000 naira. This is aimed at bringing relief to thousands of citizens battling kidney-related diseases. This subsidy is already being implemented in major federal hospitals across the 6 geopolitical zones. They include the Federal Medical Center, Ebute Metta, Lagos State, Federal Medical Center, Jabi, Abuja, the University College Hospital, Ibadan, Oyo State, Federal Medical Center, Owerri, Imo State, the University of Maiduguri Teaching Hospital, Borno State, Federal Medical Center, Abeokuta, Ogun State, Lagos University Teaching Hospital, Federal Medical Center, Azare, Bauchi State, the University of Benin Teaching Hospital, Edo State, and the University of Calabar Teaching Hospital, Cross River State. The government says more federal medical centers and teaching hospitals will be added before the end of the year to widen medical access nationwide. As part of President Tinubu's Renewed Hope agenda, last year he also approved the cesarean sections for pregnant women in federal hospitals in a bold step aimed at boosting maternal health care and preventing maternal deaths. For more on this development, the Vice President of Medical Initiative for Africa, Dr. Agbo Ebuta, joins me via Zoom from Abuja. Good to have you join us, Dr. Ebuta.
Thank you for having me.
So it's World Humanitarian Day, and I will look at this in that context, but just in terms of closing the gaps in the health sector, where does this stand?
Well, World Humanitarian Day is basically about human empathy, human welfare, reducing poverty. And when you place that in context with this recent development, and to further enlighten the public, your kidneys, we have 2 kidneys, and each of these kidney washes through fluid, blood, about 200 liters of blood every day. In the end of the process, it produces 2 liters of urine. Now, the day the kidney fails, or the period the kidney fails, that is unable, that action cannot happen, and those wastes will accumulate, and that is why people die of kidney failure. We know, based on the data available, that about 10% of the Nigerian population has chronic kidney disease. That puts it at about 225 million people out of 250 million. And out of that number, 2% of them need a form of renal replacement therapy. It means their kidneys are failed. They either go for renal transplant or they do dialysis. Dialysis is the easier to access care. And what dialysis requires is that they hook you up to a machine and it basically washes up your blood. And for optimum dialysis sessions, you need to have like 2 or 3 sessions in a week. And now for the rest of your life, if you have chronic kidney disease or end-stage renal disease, now that would cost the average Nigerian 1 million naira per month. So with the recent policy, what has happened is that Nigeria has joined an exclusive list of 11 countries that have a dialysis program that is completely free or partially subsidized. But the policy that has been put in place now, to a large extent, takes off 80%, roughly 80% of that expenditure. So if you have someone who is supposed to spend 1 million naira on dialysis a month, that relief comes to, the total cost will come to about maybe 200,000 naira or less. That is significant if you know that, if you see what patients who have, who need renal dialysis continuously, what they pass through, it is essentially catastrophic health expenditure. So this policy, it's a significant policy in terms of relieving the cost implication of being on the renal dialysis program.
I mean, that's a huge slash. When we talk about Nigeria, we talk about the crisis points. Education and health will be the first sectors we mention. I know that the president also approved, and we said that earlier in our introduction, that he also approved free cesarean sessions for pregnant women. Where are we now in terms of trying to close generally the gap in the health sector when you compare with other countries?
Well, we are still not there yet. But the point about it is that when you consider that only 11 countries have a free or a partially subsidized dialysis program amongst 195 countries recognized by United Nations, it is a significant leap. It is a step in the right direction, and we believe that this program is likely going to expand from 10 facilities, 10 federal medical centers and teaching hospitals to more facilities across the country. And we do hope that the program would shift from government subsidies to government-owned facilities to even private sector. And based on that framework, we can then start talking about free transplant programs, which is where we should head towards at the end of the day.
And you touched on what I was going to ask you next, because today is World Humanitarian, and I was going to talk about how it can also be a private sector-led approach to, or we can have a private sector-led approach to, closing the gaps in the health sector, especially access, when it comes to access to health. How does the private sector, or how can the private sector collaborate to ensure that people have access to, at least, if not free, but subsidized medical treatment?
Well, there are multiple frameworks that allow private sector to collaborate. We must say that a lot of the private sector collaborations have really assisted. Most of the kidney transplant programs we have in Nigeria today are private sector driven. I won't name names, but we do know there are multiple centers in Nigeria now that offer to a large extent kidney transplant programs. These programs are also supported by dialysis. So government has to find a framework that allows them to integrate private sector driven effort and expand it. Humanitarian interventions are not always necessarily in NGOs, private sector, or restricted to government. We are all humanitarians. You are a humanitarian. I'm a humanitarian. Once we identify that human welfare, the reduction of poverty, the interventions that would lift the spirit, reduce pain and suffering in our neighborhood to a large extent. So it's a call to duty for everybody who is in one leadership position or the other. You may be a local government chairman, a governor, or wherever you find yourself. Once you are able to take up decisions, take up policies, implement interventions that relieve human suffering and improve human welfare, you're basically a humanitarian.
Thank you so much for your time. Always a pleasure to have you on, Dr. Agbo Ebuta.
Thank you for having me. Thank you for having me.